Congress will shine a spotlight on the Ebola outbreak that has now claimed nearly 1,000 people and sickened hundreds more, including 2 Americans who are now receiving treatment at Atlanta's Emory Hospital. At a hearing this afternoon, the CDC chief will testify about the threat and the international response. Joining me now, Republican Congressman Chris Smith of New Jersey. He's the chairman of the House Global Health Subcommittee. Welcome, Congressman.
Carol, thank you very much.
Thanks for being here. I appreciate it. The head of the CDC called this the biggest and most complex Ebola outbreak in history. How would you grade the response so far?
Well, I think the Centers for Disease Control, USAID, and others, and those NGOs on the ground like Samaritan's Purse and SIM, faith-based groups that are doing and have done a magnificent job, and yet their health workers have gotten sick, as we all know. More has to be done. There are some experimental, as you've reported on at CNN very, very well, there have been a number of experimental efforts. ZMAP might provide a way of protecting those who have contracted it. But containment is high on the list to ensure that the approximately 1,000 people who have died, that death toll does not increase. Best practices, in terms of hygiene and cleanliness, the provision of fluids and antibiotics to treat co-infection, all must be applied rigorously. This is the worst, as has been said. The worst before this was about 400 dead. We're now at 1,000, and it has grown. 4 countries have been malaffected. I've been to Lagos, where some of the cases now have popped up in Nigeria. There's huge urban centers that could be incredibly malaffected. So the hearing is designed to look at what we're doing, how Congress can be more helpful if that's necessary. Are there laws or a law that needs to be changed or updated to ensure that resources match the need?
Congressman, as you know, there are widespread concerns that bringing those 2 U.S. aid workers back home to be treated could lead to an outbreak on U.S. soil. Listen to what Dr. Anthony Fauci, head of the National Institute for Allergy and Infectious Diseases, told CNN about that.
Sure.
We have the infrastructure, the ability to isolate individuals, to care for them, and protect the people who are caring for them. It is not impossible that someone is going to get on a plane after being infected in one of the West African countries, come to the United States, and develop disease while they're here. We're equipped to handle that. Now, that person might get very sick, for sure, but there won't be the kind of outbreak that you're seeing now on your clip. We're just not going to see that.
So with that said, do you think these American aid workers should have been brought back to the United States to be treated?
Oh, I think absolutely. They were brought back in the most protective means possible, fully cordoned off, both on the flight and once they got to Emory Hospital. So, we do have the capability. Dr. Fauci is truly an expert. I, too, and others would agree with this, are very concerned about others who might come here by way of a flight, who have a slight fever, and next thing you know, they have Ebola, and then everyone they have been in contact with, where there was touch or some kind of exchange of bodily fluid, we don't know, frankly, and I think it's pretty clear that it's not passed on by way of air, or breathing or getting close in that way, but the jury is always out on other ways of transmission. But I think that's where the concern needs to be. And the sooner this outbreak is contained, just like in the past, 1976 was the first time that we even saw Ebola. Maybe it's been around forever, but we don't know that. And that was contained and was completed in terms of its terrible impact very, very quickly. So the hope is, put the resources in. WHO, ECOSOC, the countries of Western Africa have all provided additional monies. But frankly, Carol, I've been in many, many hospitals and clinics throughout many countries in Africa. President Bush's PEPFAR program on AIDS built up much capacity, but there's much more capacity building that needs to be done so clinics like the ones that Samaritan's Purse was running can be multiplied, so that outbreaks like this and other infectious diseases can be mitigated in Africa and, of course, around the world.
Congressman Chris Smith of New Jersey, thank you so much for being with me.